Well, thank you everybody for joining us today for kind of a quick teaser of the upcoming Module 24 that we have. This was by far probably one of the most successful modules that we have put together, and was highly attended, but most importantly, highly loved after we finished the module, and everybody really loved it and gave it high marks and wanted us to do it again and definitely expand on it. So if you are able to come, I urge you to come, because this is going to be so helpful to many facets in your functional medicine practice. We're going to cover a lot of ideas, kind of, outside of the box thinking, and some treatment ideas that you may not have thought about before in a variety of areas, such as personalized nutrition and compounding by the awesome Dr. Jim Laval. Obviously, we're going to talk about wounds and scar, and Sebastian Dennison will be covering that, in addition to Nat Jones. I will be speaking and gabbing a lot, as always, for those of you that know me. And we'll be talking on a variety of items, including, compounding, regulations, sexual dysfunction and libido, romance and relaxation, summertime and wintertime, hospice, pain management, and travel. I will be obviously joined by my awesome, great friend and the hormone queen herself, Dr. Pamela Smith. And this year we also added compounding ideas for ENT. So if you're in the ENT practice model, this will be a great one for you to attend, because we really added a lot of specific compounded formulations for some of the refractory patients that you have in your ENT practice. So I would highly urge you. I think any specialty in medicine will find this very helpful. In addition, that we hope our pharmacy colleagues and pharmacists will join us also to help them learn some other ideas that they can share and help their practitioners with solving some of the clinical issues that we see. And with that, what I thought I would do is I would just give you a little bit of a teaser of what we're going to be presenting in beautiful Boca Raton, which I can't wait to get there because it's a lot warmer than Michigan right now. And since flu season is upon us, I wanted to give you some ideas that you can try to do to prevent the flu, hopefully, in patients, and increase their immune function, and if they have the flu, some items that you could use to try to decrease the severity. Unfortunately, flu season is upon us, and we've already had some reported cases in Michigan, and I'm sure all over the country so far. 5 to 20% of the U.S. population will get the flu in a given year. Obviously, large number sometimes are hospitalized because in the frail, elderly, immunosuppressed patients, obviously it hits them a lot harder. And the number of deaths, unfortunately, from the flu sometimes can be pretty high. It ranges anywhere from 3,000 up to 50,000 a year. And it's the 8th leading cause of death, along with pneumonia, in males in 2009. So it's still a very serious problem. Obviously, it's still high level of mortality, and we know that flu season peaks really in January and February. Everybody is obviously promoting the flu shots right now, so we can hopefully decrease that incidence. But remember also, the flu vaccines are only about 40 to 50% effective, and less effective in the elderly, which obviously they are our most prone and frail patients. So the reason why also, obviously, sometimes we don't quite get it with the flu shot, if you will, there's different strains, obviously, of the influenza virus, and sometimes we're not catching all of it. So obviously what the CDC tries to do every year is to see what strains did we see in the past year or two and modify the vaccine, obviously according to that, to try to capture what we saw and maybe even predict some of the future outbreaks. So this is what the CDC recommends: 3 courses of action, obviously, to prevent the flu transmission and outbreak. Get the flu vaccine yearly. Again, but remember, just because you get vaccinated does not mean you're not going to get the flu. It's only about 40 to 50% effective. So even if you have the flu shot, and there's pros and cons to that, obviously, and that's a different discussion, you still want to follow these guidelines, because again, you can still get the flu. you want to try to prevent the spread of germs on a daily basis, especially in the winter months, because there's just a lot of them floating around. Avoid close contact with those who are ill. Obviously, in the medical profession, that's really hard for us to do because, unfortunately, everybody that gets sick comes in to see us. But try to keep obviously kids from school if they're ill, going to workplace, even though sometimes you're really motivated or there's deadlines, but stay home because you don't want to get all your colleagues sick. Cover your nose and mouth with tissue when coughing and sneezing. Wash hands tons, tons, tons. Avoid touching eyes, nose, and mouth, obviously pathways of transmission, and clean and disinfect your surfaces all the time. I love colloidal or silver hydrosol. Um, Hydrogen peroxide, it was shown in studies to kill viruses and bugs within 30 seconds. So I love those versus the alcohol, which because I think they're more effective and they're also more natural. So I always carry some diluted hydrogen peroxide or Argentin in my purse. So I can disinfect hands and surfaces, especially as you guys know, I fly a lot. So I disinfect all these airline seats. And take flu antiviral drugs if they are prescribed by a doctor. So obviously, they recommend that people 6 months of age and older get the flu vaccine. And obviously, if somebody is sick, pregnant women, seniors, but again, some of the data is showing that the flu vaccine is actually the least effective in older, more prone patients to obviously the adverse effects from the flu virus. Now, you can't get the flu from the flu vaccine. The vaccine protects from the flu within reason, obviously, and not the common cold, so you may experience some side effects. Obviously, mild reaction to the flu vaccine, such as soreness, headaches, and fever, could be common, to the more serious side effects, such as Guillain-Barré. So obviously, just like with everything, there's pros and cons to everything. You have this season we have the trivalent and quadrivalent, flu shot, obviously. It's made with the inactivated protein coats of the virus, and it is approved for people older than 6 months of age. The nasal spray, or, the flu mint, obviously is made with a weakened live virus. So it's given with a mist sprayed in the nose, and it's approved for healthy people between the ages of 2 and 49, except for pregnant women. Obviously, we recommend that people start getting their flu vaccine if they are candidates and if they want to get vaccinated. Again, there's pros and cons, I think, to both sides, to really get it as early as possible, September, October. Okay, so what can we do to boost our immune system? Because I really think it's all about the immune system, and what can we give you some ideas? Okay, so what can you do to maintain a strong immune system, which is your best line of defense against anything? A good multivitamin and mineral supplement. Again, we all would rather that you eat your vitamins, so if you have a great, healthy, varied diet, that's great. Keep doing that. If not, you want to get a good multivitamin and a multi-mineral supplement, because that really helps with antioxidants, it helps with enzymatic reactions, and it helps just the body overall, including the immune system, work better. Okay. Fish oil is great. Obviously, it's good for 1,000,001 things, but it's really good, obviously, as an anti-inflammatory in the body. A good probiotics. Remember, 70% of the immune system is in your GI tract, so keeping a good gut basically means good immune system. And so a good multi-strain high-dose probiotic is awesome. Obviously, vitamin D is amazing for 1,000,001 things, but definitely it really gives great cellular support to boost the immune system. Vitamin C obviously can really help with boosting the immune system. You want non-corn source because it's much better, obviously less GMO'd. If you get sick, or if you are traveling, or if you're around a bunch of sick people, I think echinacea short term is good to stimulate the immune system so you cannot get sick. And if you get sick, echinacea I think can be very helpful in shortening the course. EGCG, again, green tea extract standardized to EGCG, supports overall health and definitely the immune system. Zinc lozenges, many studies have shown that zinc helps decrease, obviously, colds, the duration of colds and the flu. And in the winter season, a good multivitamin or even a zinc supplement might be good to really boost your immune system. Remember, if you take zinc, unless you have Wilson's disease, you want to balance it with copper. So about 20 milligrams of zinc roughly with 1 milligram of copper to keep both of them in equilibrium. Medicinal mushrooms are a great way for adrenal support, which is very good for, the adrenals are very important for immune modulation and support. But medicinal mushrooms, again, great ways to boost your immune system. Reishi mushrooms, cordyceps, and turkey tail. Great data with turkey tail now in cancer treatments because of boosting of the immune system. Now, if you get sick or kids get sick with the flu, obviously they're all ordering the Tamiflu or the oseltamivir, oral suspensions for them. So this is something that can be compounded in liquids for kids or elderly people that are not able to, swallow, obviously, the capsules. Now, what are good ways that you can prevent the flu, because that's the most important thing, or if you get it, what can you do? So something that's compounded that would be awesome, something like Tranlisat 1% with D-deoxyglucose, which is a natural antiviral, also known as Fly Safe. So you apply this inside the nostrils daily. I love this one, or Fly Safe with EGCG. Immunosuppressed patients, cancer patients, elderly, young, this is a great thing that they can put in their nostril every day. It's basically an ointmenty-like thing that we can compound and they can stick in their nose, because remember, the most significant ways of passages of viruses in our body is through the eyes, nose, or mouth. And so this is a great line of defense, and it helps boost the immune system. And B, EGCG and D-deoxyglucose have antiviral properties. So if you're exposed to viruses or bacteria, they can help kill them. EGCG, lollipop a day. So this is a great one too that we make in lollipop, because it really kind of boosts the immune system and mucosal defense through the mouth. Now, if somebody gets sick, this is a great one because it really helps decongest. Menthol and eucalyptus sorbitol lollipop, so these are good for decongestion. Tetracaine, sometimes for really sore throats if people have strep throat or really bad sore throat. I love elderberry as a soother for sore throat, so elderberry syrup or lozenges are awesome for that too if you want non-drug, natural solution for sore throat and painful throats. Lidocaine with vitamin C, again, helps boost the immune system and it helps numb the throat. EGCG troches, again, they help boost the immune system and they're great antioxidants and just a general nice tonic to the throat, and those can be flavored in any flavor that the patient likes. EGCG, as you can see, has great antiviral properties, so there's a lot of different ways that you can give this. You can give this in a 200 milligram oral effervescent powder. You can also do EGCG nasal spray. So again, it's a great antioxidant in the flu season, cold season, great antioxidant and great to just spray and boost people's immune system. You can also do the D-deoxyglucose with EGCG nasal spray. That's also applied for these people daily. Cimetidine, very interesting. Not a great reflex drug, but cimetidine, great immune modulator for the treatment of several diseases such as herpes simplex and mucocutaneous candidiasis. So cimetidine, actually topical on cold sores, can really cut their duration significantly, almost down to 1 day. Also, cimetidine nasal spray can be very good as an immunomodulator, again, to decrease the risk of flu outbreaks. Again, what we're trying to do is boost your immune system. And very interesting, statins may be linked with reduced mortality in patients hospitalized with the flu because of the, obviously, we think statins really help mainly probably from their anti-inflammatory response. Now, if you feel horrible, what can we do? So we can mix something with acetaminophen, although make sure they got enough glutathione on board to really support their detox pathways, with a little bit of phenylephrine, obviously decongestant, dextromethorphan, and vitamin C in an effervescent powder. You can also use acetaminophen with phenylephrine, chlorpheniramine, obviously, antihistamine with a cough suppressant, and vitamin C for nighttime. That may help them be sedated and sleep better also. So there's a lot of websites here that I told you with their guidelines and all that good stuff that like they usually do. So I hope that this has given you a bit of a teaser of what's upcoming in Boca Raton, and I hope that this one specifically has given you just some helpful hints of how you can hopefully prevent the flu in people that are more are more prone to getting the flu, or if they do not want to be vaccinated. And again, being vaccinated does not limit you or prevent you from getting the flu. And this has given you some helpful hints how to prevent the flu, boost the immune system, but if you get sick, some other alternative ways that you can help people manage the symptoms of the flu. And with that, I thank you for your attention, and I hope to see all of you guys in Boca in a couple weeks.
Thank you so much, everyone, for your time, especially you, Sahar. We look forward to seeing you all in Boca for this fantastic module and to meet our dynamic experts in the field. Please call to reserve your spot today, 561-910-4960. Thank you so much, Sahar.
Thank you all. Take care. Have a great day.